many of you have lost a pet? How many of you have made the painful decision to put a pet to sleep to save it from a horrible death? Now, how many of you have known somebody with a terminal illness that died a long and horrific death? Our society values life, but struggles with humane ways to let people pass in peace. We are easier on our pets than we are on our people. Today, I'm going to convince you that euthanasia is not murder. It should be another option for end-of-life care for the terminally ill. I'm going to tell you about euthanasia and the other options that doctors use today in the United States for the terminally ill. Euthanasia, also known as mercy killing, is the advancing of a suffering person's terminal illness to death. A terminal illness is somebody who has less than 6 months to live. Medical communities disagree about what euthanasia is. According to the Mayo Clinic, some doctors feel that pacemaker removal is euthanasia, while others do not. Doctors want to help their patients, but they are legally bound and can't always do what patients want. Euthanasia should be an option for the terminally ill. According to Dr. Timothy Quill, who was interviewed about the Dr. Jack Kevorkian trial at pbs.org, he stated that a study out of Washington State said 16% of doctors were requested by patients for a lethal medication prescription, and a quarter of those doctors complied and gave those patients lethal medication prescriptions. The state of Oregon has recognized the problem and the desire for people to end their life sooner than the disease does. They enacted the Death with Dignity Act in October of 1997. This allows residents of Oregon who are 18 years and older, who can communicate their health care wishes, and who have a terminal illness that will allow them to die within 6 months or less, to self-administer lethal medication in order to end their life. This is prescribed by a physician who collects the data from them and reports to the Oregon Health Authority. The Oregon Health Authority also publishes annual reports about anybody who participates in the Death for Dignity Act. It's the physician's decision, and it's under their control. They can decide if they need more counseling or if the patient is just truly depressed and is not a good candidate for this act. Euthanasia should be an option for the terminally ill. Dr. Jack Kevorkian, also known as Dr. Death, assisted many people with suicides with his suicide machine. He brought euthanasia out of the closet. Dr. Timothy Quill hoped that his trial might bring the attention to better care for our dying. In the New York Times obituary for Dr. Jack Kevorkian, Jack Lessenberry, who is with the Detroit Metro Times, was quoted as saying, "Jack Kevorkian, faults and all, was a major force for good in this society. He forced us to pay attention to one of the biggest elephants in society. The fact that today vast numbers of people are alive who would rather be dead, who have lives not worth living. Euthanasia should be an option for the terminally ill." There are other legal forms that doctors can use other than euthanasia or physician-assisted suicide. They are, according to StopPain.org, withholding and withdrawal of treatment, DNRs or do not resuscitate orders, removal of artificial hydration and nutrition, and sedation in the terminally ill. The withholding and withdrawal of treatment is usually removing a breathing tube. Removal of feeding tubes is the removal of hydration and nutrition. Sedation in the imminently ill is when people are given sedation drugs to make them more calm and basically in a coma, in a vegetative state, so they are more comfortable and not in pain. It is not euthanasia to give them sedation, but we need to give doctors another option. Euthanasia needs to be an option for the terminally ill. These other ways that doctors can legally deal with patients' end of life make patients more comfortable without trying to cure patients or prolong their lives. However, as StopPain.org states, physician-assisted suicide and euthanasia imply recognition not only of the right to be released of suffering, but also of the right to die. Diseases such as ALS, also known as Lou Gehrig's disease, Alzheimer's, advanced cancer, Huntington's disease, and numerous others are all diseases that can lead people to want to choose death rather than suffer a horrific, long, painful death and have their loved ones watch as they stand by and can't do anything. Today I've talked to you about euthanasia, and I hope I've convinced you that it's not murder and it should be another option for end-of-life care for the terminally ill. Samuel Beckett said, "No, I regret nothing. All I regret is having been born. Dying is such a long, tiresome business I always found. So I say to you today, let's not let dying be long. Let's let living be long and dying be short. Let's give the terminally ill another option: euthanasia."